All. This is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So today I'm going to discuss an article written by the scientists in the US about the possible involvement of the endocrine system in long COVID. Now, this could be because during the acute COVID, the viral infection disrupted the glands, or during the acute COVID or afterwards, the immune dysregulation caused disruption of the glands. The studies that these authors have suggested or shown, they have both sets of studies. Just like I do in my discussions that I present, here is something that these authors are saying, here is some balancing opposing views as well. Similarly, these authors, for today's discussion, they have the studies that prove their point of saying that there is an endocrine issue. At the same time, they also have studies that say or present patients who did not have endocrine issue. That simply means that it is not necessary that hormonal disruption will occur in everyone. However, those patients of long COVID who have chronic fatigue or fatigue developed, anxiety, fever, tachycardia, hydration issues, they should look at their hormonal statuses. So before I go in the discussion, what should a patient who may have long COVID issues and hormonal imbalances, what should they do? I think that is the most important thing. So number one, get the labs done for hypothalamic, pituitary, adrenal axis. So that is these three hormones. So that would mean, for example, testing for adrenocorticotropic hormone, corticotropic releasing hormone, and the cortisol levels, aldosterone levels, and so on. So that is one. Second, thyroid levels, parathyroid levels, and then pancreatic function profile or glucose levels, and then suprarenal medullary profile or the adrenaline, noradrenaline, dopamine levels or their labs. So this is important. In addition to this, if there is an abnormality in these labs, then one has to figure out, is it because of the damage to the tissues or is it because of an autoimmune attack on these tissues? So then the second level of labs will be to try to figure out what is going on with these hormones. So let's start with these hormones and these glands. So references, this is drbeen.com. In the description, there is a link that has drbeen.com access at a very affordable price. This is the article, COVID-19 and Chronic Fatigue Syndrome, an Endocrine Perspective. And look at the researchers and their institutions. National Institute of Diabetes and Digestive and Kidney Diseases, National Institute of Health, Bethesda, MD, United States. Department of Medicine, Fox Chase Cancer Center, Philadelphia, Pennsylvania, US. Department of Medicine, Endocrinology, the University of Tennessee Health Science Center, Memphis, Tennessee, and so on. The author, the corresponding author, is Rashika Bansal. Beautifully written article. This is not a study, this is actually an article. Then in this article, they discuss the presence of ACE2 enzyme or the receptors on various tissues. And they have provided a link to this site. This is the Human Proteins Atlas. I had actually not seen this site. I feel bad that so far I had not seen it. This is awesome. So here, for example, this is ACE2. And for ACE2 enzyme or protein, this is the distribution of where the ACE2 enzymes are present. and where the messenger RNA is seen, and so on. This is a beautiful site. It's kind of fun to go through this. Specifically nowadays with COVID, it becomes even more interesting to see where are the ACE2 enzymes. And the relationship to the talk today is that ACE2 enzymes are present in hypothalamus, pituitary, thyroid, pancreas, and suprarenal glands, even testes as well. This is another article that talks about the definition of long COVID. The authors in their article have divided the definition, or have provided two definitions of long COVID. One is what they call long COVID, and that they say is continuity of the symptoms beyond 4 weeks from the onset of the disease. And then they talk about post-acute. That is what you're seeing here. Post-acute COVID-19 syndrome. This is what they talk about when the disease either continues beyond 12 weeks or illness goes away, the person recovers, and then unexplained symptoms appear. Unexplained, that no other disease or diagnosis can explain what is going on. And then those are also after 12 weeks. And then these would also be called post-acute COVID-19 syndrome. Then this is a very important thing, and we are going to discuss this. And so let me put this little text in front of us right now. Hypocortisolism. So suprarenal gland, the gland on top of our kidneys, or that sits on top of our kidneys on both sides. Suprarenal gland it releases many hormones. One important hormone is cortisol or steroids. If that gland does not release steroids correctly or in the sufficient amount, then we get hypocortisolism, in which we get fever, we get lethargy, fatigue, sleep disturbance, and so on. So if you see here, symptoms of adrenal insufficiency include fatigue, weight loss, hypotension, hyperpigmentation of the skin. Since aldosterone will also be deficient, and I'll explain that when I'll go over the discussion, lab results will show hyperkalemia. So this is important to do sodium levels, potassium levels. Glucocorticoid replacement therapy such as hydrocortisone is required to treat these symptoms. Then this is John Hopkins about adrenal insufficiency. Just have it here for your reference. The link is in the description. This is another article for how the hypocortisolism can occur, or how the Addison's disease can occur, or how adrenal insufficiency can occur, and we'll discuss more. And finally, after this talk, we will go to this channel. This is Cool Beans Cafe Live, and that is where we'll do some question answers and other discussions. So with this, now let's start with the drawings. So first, this is kind of the basic summary of the whole article. What they're saying is that people who develop symptoms after acute COVID, most of the time it is women who develop it, because women generally have more aggressive immune system, and they develop more immune system imbalances compared to men. They develop more autoimmune diseases compared to men. So women usually, in this case, long COVID, women have I shouldn't say usually, women develop long COVID more often than men. And what could be the issues? There can be many pathophysiologies. We are doing a complete series here. Pituitary and hypothalamus, these can be involved. Thyroid can be involved, resulting in, let's say, hypothyroidism. Even hyperthyroidism can occur as well, because of the autoimmune attack and inflammation of the thyroid, resulting in hyperthyroidism. And if the tissue destruction occurs, or the signal to thyroid becomes disrupted, then hypothyroidism can occur as well. Suprarenal gland, the glands above the kidney, their disruption can occur too. There are genetic factors as well that can predispose a person towards the fatigue or chronic fatigue type syndromes. There are epigenetic issues as well. There is microbiome disruption that is possible too. And I would have that discussion too. I have a study lined up that I'm going to discuss. Tomorrow, I'm actually going to discuss the suprarenal medulla and that the acetylcholine and the effect of acetylcholine for long COVID. Today, we're talking about suprarenal cortex. Then this is the part of the article that I'm not very much sure about, and that is persistence of the virus itself. I think that is yet not proven, but anyways, that is part of the article, that maybe there is persistence. Then immune dysregulation, and we have been talking about it for a long time. Immune dysregulation could be immune system cell dysregulation or the possibility of the antibody production and the tissue damages. Then, of course, the various organs and their disruption. For example, kidneys damage, heart damage. The heart is hiding behind the kidney here. And then lung damage. And based on the kind of damage, one could develop the sequelae or the outcomes of that damage. As I said before, the definitions they have are the following. From the onset of the disease, acute COVID, if it continues beyond 4 weeks and continues with the symptoms, not that the symptoms became recovered, the person became recovered and then the symptoms reappeared, but instead, if the symptoms continue, they beyond 4 weeks, and they call it long COVID. If the symptoms appear or continue to be there after 12 weeks, then they call it post-acute COVID syndrome or post-COVID syndrome. Now, we have done this discussion. This is not part of this article, but we have done this discussion from the UK's Office of National Statistics data that 2.7% of the population of UK is currently suffering with long COVID. Now, what is the endocrine connection? So now I'm back to the article. And please don't look at these diagrams as anatomically correct. These diagrams are just for illustration purposes. So here, the presence of ACE2 enzymes themselves. These are present, ACE2 enzymes, on hypothalamus, pituitary, pineal gland, thyroid and parathyroid, mammary glands, suprarenal, these are the glands present on top of the kidney, pancreas, ovary, and testis. All of these places do have ACE2. And I believe we have done this discussion. Highest density of ACE2 is in kidney, then GIT, then heart, lungs, and brain. However, as I just discussed, the endocrine tissue also have ACE2. So now they talk about various studies. So first of all, they talk about some postmortems. And you know my position on postmortems, that somebody who has died, of course, they had a more widespread effect of the virus. Of course, their systems, tissues broke down, and the virus had a privilege, had an opportunity to enter even those areas where normally it will not go. So postmortem is interesting to see what tissues ended up with the virus, but it may not be the case for every living human being who was infected. Still, what they talk about is here, this top is hypothalamus is here, and pituitary is this. This is thyroid. These little rounded things within the thyroid are parathyroids. These are kidneys. And then these blue things on top of kidney, like little caps, are the suprarenal glands or adrenal glands. And this sadly penis-looking thing is pancreas. I can never make it correctly. So they say that in the post-mortem studies, they have found the viral damage to pituitary, parathyroids, adrenals, and pancreas, which also means if this is happening in living human beings who did not become severe enough to then die, it may be that there is tissue damage. Then they talk about another study. This study is about thyroid gland. Now, thyroid has small spheres. So if you see these spheres, the red spheres, thyroid has small spheres, balls, which are called follicles. The follicles have the machinery to make thyroid hormone. Surrounding these balls or between the balls are parafollicular cells or other cells present here. All of these things together make up the thyroid gland and function as thyroid. And they saw, so this is not a post-mortem study, this is actually a living human being study. So in this study, they saw that the follicles and the follicular cells were apoptotic. They were dying in the COVID infection. And the parafollicular cells were dying as well. So they saw apoptotic cells of the thyroid follicles and parafollicles. They also observed that thyroid hormone levels were less as well. Of course, if the tissue is becoming damaged, then the hormone production would reduce as well. With that, there was osteonecrosis of the femur's head. That means the bone damage was observed as well. So this is another study. What is the point of this? They say that there are studies that show viral damage to thyroid gland as well. So now we are proving or seeing viral damage to hypothalamus or pituitary, thyroid, parathyroid, suprarenals, and pancreas. Then in another study, they said that zona fasciculata of the suprarenal gland did not function correctly. So let me explain this part. On top of our kidneys sit two glands, one on each kidney. These tiny glands are really crucial for us to live normally and to live. These are called suprarenal glands or adrenal glands. These glands, if you see here, this triangular one, these glands have two main parts. One is called the cortex, that is the outer part, and then this blue one inside, the central part, is called medulla. We all know that medulla produces adrenaline, noradrenaline, dopamine. These are very important hormones or basically neurotransmitters for flight and fright response, right? So stress responses. Outside the cortex is further divided into three parts. The outermost part is called zona glomerulosa. Then the middle part, or between the glomerulosa and the inner part, is called the zona fasciculata. And these names are based on their histological appearance. And then the inner part of the cortex is called zona reticularis. We used to, in medical schools, remember what kind of hormones come from which layer by saying the deeper you go, the sweeter it becomes. And what that means is zona glomerulosa, the outermost layer, is responsible to function with or to manage or release mineralocorticoids. These hormones, mineralocorticoid, their function is to keep a balance of sodium and potassium, for example. And in addition to that, then the water or the fluid volume. So when suprarenal gland can, if it becomes disrupted, our fluid volume will become disrupted, which will mean we'll start becoming thirsty, number one. Number two, it is sometimes possible that we are not thirsty because body has just adapted to it. However, we might develop postural tachycardia because the fluid volume is less. And so every time we'll stand up, we'll develop tachycardia because there isn't sufficient fluid to provide correct blood pressure and the oxygenation and nutrition to the right tissues. So the blood pressure would fall when we'll stand up and we'll get tachycardia. The second part, the zona fasciculata, that has an important function of releasing glucocorticoids or steroids, cortisol. So if zona fasciculata is damaged, then the cortisol levels are reduced, and steroids are really important for us to function correctly. And if they are not present, we develop chronic fatigue, we develop lethargy, we develop confusion, we develop fever, we develop weight loss, we can even develop skin pigmentation. And they saw in this study that about 39% of the patients who had COVID-19, they developed reduced levels of cortisol. 39% of the patients. That's a big number to develop suprarenal imbalance. Steroid imbalance would just cause so much disruption in our body. And this was observed 3 months after the recovery. So the person got COVID, recovered, 3 months later, they develop cortisol level imbalance. Then the deeper layer is androgens and estrogens. So these are sex-related hormones. That is why the deeper you go, the sweeter it becomes. And then finally, within the medulla is the catecholamines. And we'll talk about that tomorrow. So this is important from suprarenal point of view. Now, HPA axis disruption. What is this? What is HPA? Hypothalamus, pituitary, adrenal. So hypothalamus is the top master switch for the hormones or hormonal system or endocrine system's boss is hypothalamus. Sometimes we say that hypothalamus with pituitary becomes a complex, and they together are the controlling mechanism for the endocrine system. So hypothalamus, I'm talking about HPA axis, and it gets disrupted in COVID. HPA axis is hypothalamus, pituitary, adrenal connection. So what happens is hypothalamus releases a hormone called corticotropin releasing hormone or CRH. That hormone is a message to the anterior pituitary, which is just sitting right below the hypothalamus. It's a P-shaped small structure. So the message comes in from hypothalamus to anterior pituitary to produce, to ask the suprarenal glands to work, for example. So corticotropic releasing hormone message comes in. Pituitary, anterior pituitary, in response, produces ACTH, adrenocorticotropic hormone. This ACTH that is released by anterior pituitary, that goes and acts on the suprarenal gland where the zona fasciculata, middle layer of the cortex. And the result is that cortex releases cortisol, which are the steroids. This is the axis. Hypothalamus tells the pituitary, pituitary then tells the suprarenal, that releases the cortisol. Then there is a negative feedback. If there is too much cortisol, then the hypothalamus is asked to reduce the orders to produce more. If there is less cortisol, then the hypothalamus is asked to provide the orders to produce more. So there is a negative feedback system. This whole system together is called HPA axis. They saw, they referred or they linked studies that showed that after the COVID infection, this axis gets disrupted. And the result of that is, and this happens even a year after the acute infection, a year after, this axis is still disrupted in some people, which will mean they will be fatigued, lethargic, develop tachycardias very often, may develop weight loss as well, may have GIT disruptions, nausea, vomiting, which they might actually think that it is something to relate with, let's say, microbiomes, or to relate. I am seeing doctors diagnosing patients with IBS because they have GIT issues. So how can we find out if it is related to HPA? The cortisol levels, ACTH levels. So HPA axis needs to be looked at. Even potassium will be more, so hyperkalemia will be seen in these patients. This is very important. I hope that this one point is captured. If you are, that should be the takeaway of this video. So a year after, it is possible that the cortisol levels are still low. Then if you look at this side, it discussed various studies which attempted to provide the pathophysiology, the mechanism. Why does this happen? So one mechanism is the hypophysitis. That is the inflammation of this area. Remember in the beginning, we said that there are ACE2 enzymes present on hypothalamus and pituitary. So maybe there was infection of it, and they linked the studies that show that the brain may get SARS-CoV-2. So if the hypothalamus is inflamed, that inflammation could cause disruption of the hypothalamic function and disruption of the HPA axis. Question is, will the patient recover, or will this become a permanent damage? So to me, it seems like, this is not the authors, this is me. To me, it seems like in some patients, recovery occurs. Some patients actually do not even get this problem. Then some patients have this HPA axis disruption, but they recover. And some patients develop a longer time issue, although I'm still seeing long COVID patients continue to improve. I have seen some patients who do not, but most of the patients continue to improve. So hypophysitis is one possibility. Hypothalamic damage is another possibility. Then this is a very important one, this little part here. They connected or referred a study. Check this out. This is very interesting, which said that the SARS-CoV-2 virus expresses amino acids. Of course, the virus would make proteins, its own proteins, and it has proteins, correct? Spike protein is made up of proteins. It expresses amino acids, which are the protein building blocks. So it expresses sequences, or should I say epitopes, because we have all been discussing immunology for 2.5 years now. So epitopes, right? Combination of amino acids that can be an antigen. So they say that SARS-CoV-2 expresses amino acids that look like adrenocorticotropic hormone molecule. So when our body makes antibodies against the SARS-CoV-2, because of this molecular mimicry, because of this similarity of the epitope, our body accidentally ends up attacking the ACTH molecule, adrenocorticotropic hormone molecule. Where is this molecule's function? I just described it before, so let me very quickly say it again. Hypothalamus releases CRH that goes to anterior pituitary, and anterior pituitary releases ACTH, which has to go to suprarenal gland and give the message to say, hey, suprarenal gland, make cortisol or release cortisol. This ACTH, the most important messenger coming from anterior pituitary going to the suprarenal, that messenger molecule may be attacked on its way by antibodies, so it doesn't reach the suprarenal gland to give the message. So hypothalamus is working fine. It is asking the pituitary to produce ACTH, and pituitary is producing ACTH as well. But ACTH is attacked by our immune system, by our antibodies, and suprarenal gland never got the message. So that is one more possibility. Then they said this is also possible that in our severe cases or hospitalized cases, there is a vast number of patients who are in hospital or in severe cases that are receiving or that are given steroids because that is part of the protocol. Now, if I go back here for a second, when a person is given steroids, high dose steroids, or chronic use of steroid for other reasons, what happens is now steroids are present in that person's body. Those steroids go to hypothalamus and tell it that, hey, the hypothalamus senses lots of steroid in the blood. So it says, I think I should not make more steroid. There is already enough amount. So the message from hypothalamus to pituitary, the CRH, reduces. Because hypothalamus says, sufficient steroid already present, why should I make more? That means pituitary is not going to make ACTH and send the message to the adrenal gland. So when the ACTH message is reduced to adrenal gland will not make steroid. When the adrenal gland will not make steroid, slowly the steroid making cells will become down-regulated and they will perish away. This is our body's rule. Use it or lose it. So because steroids are coming in our body from outside, the internal mechanism to make steroid says, all right, fine, I am not needed, so I'm going to reduce my cells. Now imagine if the steroids are abruptly stopped. All of a sudden, the body needs steroids for its regular normal function. And it is looking towards the HPA axis to say, give me more steroids. But even now that hypothalamus knows that there is less steroid in the blood, and it sends a message to pituitary saying, here is CRH, here is my message to you that please get more steroids released. And pituitary very obediently then responds and sends ACTH to suprarenal gland to say, make steroids and release steroid. Suprarenal gland still cannot make them correctly. Why? Because the cells are gone. So what happens is suprarenal gland is now under stress. It tries to very quickly come up to speed. In that process, it can actually get severely damaged. And we can develop Addison's disease. So anyways, that's a different discussion. But the authors are saying that sudden cessation of steroids, which the risk of which has increased because there is so massive use, at scale use of steroids nowadays, that we can have HPA disruption. Then at the end of this discussion, they do say that, hey, data is limited and there are studies that show the problem and there are studies that do not show this problem in some patients. So that means we still need to do some more discussions. We still need to do some more research. However, here is the research that they saw. All right, continuing. After the HPA axis, the authors then talk about adrenal glands themselves, the glands. These are the suprarenal glands sitting on top of kidneys, one on each kidney. They say that in the post-mortem studies of COVID patients, they saw for the suprarenal glands, they saw pathologies, for example, microscopic adrenal lesions, small injuries, microscopic injuries to the suprarenal gland. Now, was that because a person was dying and their tissues were getting damaged during the process of death, nutritional issues, oxygenation issues, respiratory distress, and so on? Or was that the damage because of the virus? Or was that the damage because of inflammatory markers and inflammatory molecules? They don't know that. But suprarenal glands show microscopic lesions. Number one. Number two, suprarenal gland shows hemorrhages. So there is bleeding. That means there are tissue damages that are occurring, tissue damage that is occurring, and there is hemorrhages within the suprarenal gland. Then third, suprarenal gland show infarctions. Just like we have heart attack and there is infarction in the heart, infarction simply means death of the tissue. So suprarenal gland is under so much stress that it dies, the tissue becomes necrosed. Either that is an infection, or that is extra work needed, or that is lack of nutrition and inflammation of the suprarenal gland. Something happened and the tissue died. So there are signs or observation of infarction. So if this is happening in the living human beings as well who had COVID, or who may have developed this situation afterwards because of immune dysregulation, then primary adrenal insufficiency would occur. But why do we call it primary? So if I go back here, this is suprarenal gland. When the suprarenal gland itself is damaged and cannot produce its hormones, then we say this is a primary issue, because this is at the site of the problem is at the site where the production is of the hormones. If there is a problem with the pituitary, and pituitary is not able to give message to the suprarenal gland, then this is called the secondary insufficiency, because the suprarenal gland themselves are okay, but the organ or the tissue that is sending them the messages, that tissue is not working. So it's a secondary problem. And if the hypothalamus is not able to send a message to pituitary, and then pituitary does not send a message to adrenals, then that is called a tertiary failure. So this could be primary, secondary, or tertiary, depending upon which tissue is not working. Here, we are talking about primary damage. Primary damage. That would be called the suprarenal primary adrenal insufficiency, which would mean fatigue, lethargy, weight loss, confusion, fever, even GIT abnormalities, nausea, vomiting. And then this can happen by iatrogenic adrenal insufficiency. That is, iatrogenic is medical related injury. So this is when I discussed more steroids are used, and then if they are abruptly stopped, then the gland can be damaged. Then they talk about thyroid. So now we have talked about HPA. We have talked about suprarenal gland itself. Now thyroid. Because in long COVID, it is actually possible to have hypothyroidism, which would also create fatigue and lethargy. The only difference from HPA axis problem is that in the HPA or the suprarenal, there will be weight loss. In the hypothyroid, there would be weight gain. Plus, hypothyroid would also be the cold intolerance and so on. So they have different kind of symptoms. Now for thyroid, they say that we do not have large studies to back up that thyroid gland may be damaged. So they refer to case reports. So case reports are not studies. These are anecdotal things. So there are three that they have connected. One is a patient who developed Hashimoto's after COVID. One case where they developed autoimmune hyperparathyroidism. and one is where they developed autoimmune hyperparathyroidism in a patient who already had Graves' disease and was in remission, and now their thyroid became bad again. So these are the three cases. And then they say that once again, there are studies that show no change to thyroid, all good to thyroid, even after severe cases. So they said keep it in that balance. And finally, the pancreas. So just like thyroid, I did not mention this. The damage here is the cytopathologic. That is, the cells of the thyroid could die. As I mentioned in the early part, they observed the cells doing apoptosis or dying. Similarly, cytopathology could occur for the pancreas as well. Now, that could be because of the viral inflammation, viral infection and inflammation of pancreas. That could be because of general inflammation and that those inflammatory molecules going to pancreas as well and causing local inflammation and damage. That could be because of autoimmune dysregulation. So immune system dysregulation creating autoimmune disorders, which in turn can attack parts of the pancreas. And they talk about SARS-CoV, not 2, but SARS-CoV and MERS-CoV, where the pancreas and thyroid were observed to be damaged. And I had actually taught one study as well 2 years ago that SARS-CoV-1 patients were observed to develop diabetes 10 years before their age mates. So there can be a possibility of damage to pancreas as well. So this is the discussion. I would request you to, of course, I kind of summarized it, but I would request you that if you can also read this article, it is actually a good study. And finally, if I summarize it, what is the takeaway? The takeaway is please have if you are someone who has long COVID, if you have lethargy, fatigue, confusion, brain fog, nausea, vomiting, GIT, weight loss, even skin discoloration, then please get your endocrine system worked up as well. And also look at the potassium levels too. Also look at blood volumes and the sodium and other levels too, because tachycardia could be related to this, because GIT issues could be related to this. And they make a comment in the article. They say that it is possible that people have HPA, hypothalamus, pituitary, suprarenal gland, or adrenal gland dysregulation, causing GIT symptoms. But because we know that GIT symptoms occur because of the virus as well, many times it is possible that GIT symptoms are just slotted under the viral issue, and we do not suspect that this may be HPA dysregulation. So when these symptoms are present, we should look up for HPA as well. That is a discussion. Thank you very much. I'm seeing lots of super chats today. So thank you for your support. And actually, talking about the support, thank you to Margaret McInnes. Yesterday, she sent a very significant support. So thank you, Margaret, for that. And if you would like to support this work, there are links in the description. You can purchase drbeen.com access to the premium content. And for a price under $100, you have access to 1,000 videos. I was talking with our marketing team today. They had a new member and he was going crazy to say, you give access to 1,000 videos for this amount? And he was showing me other courses and saying, these other courses have one video for $100 and what are you doing? So anyways, take advantage of that. And then in addition to that, if you would like to support this work, you can buy me a coffee or you can use PayPal. You can become part of Substack or a patron, and we can go from there. And finally, I'll leave the link to Drbeen's Cafe Live. And we will now shut down here, hang up here, and go over there. And if there is any further discussion or questions, we'll have them over there. Thank you very much. See you soon.